So this video is going to be about vomiting. Vomiting refers to acute expulsion of the gastric contents through the mouth. Vomiting have to be differentiated from regurgitation, especially in case of infants, because regurgitation is the involuntary and effortless expulsion of small amounts of gastric contents that is not accompanied by nausea. Recurrent or persistent vomiting needs thorough evaluation and also treatment. Persistent vomiting may be complicated by dehydration, hypokalemic, hypochloremic, metabolic alkalosis, malnutrition, and constipation. Vigorous vomiting can uncommonly result in esophageal mucosal tears called the Mallory-Weiss tear or the rupture, Boerhaave syndrome. Vomiting is a common but most often non-specific symptom that may be acute, chronic, or it can be recurrent. Short-lasting vomiting with acute onset is the most common form and is associated with viral infections. Chronic vomiting may be cyclic, characterized by more than or equal to 5 stereotype episodes occurring at high intensity, that is more than or equal to 5 mSs per hour, and infrequently more than or equal to less than or equal to 2 episodes per week, with normalcy in between, or chronic characterized by frequent episodes more than 2 per week at low intensity 1 to 2 mSs per hour. While chronic vomiting is usually caused by a gastrointestinal etiology, cyclic vomiting is predominantly due to neurologic, metabolic, and endocrine causes. Evaluation. A detailed history and examination often gives us clue to the diagnosis, and the etiology of vomiting varies according to the age. While the infectious causes occur at all ages, most of the congenital anomalies remain confined to the neonatal period or infancy, like for instance atresia, stenosis, or metabolic disorders. The first step is to find out whether the vomitus is bilious or not. This determines the site of disease. Lesions beyond the ampulla of Vater cause bilious vomiting. So the landmark is going to be ampulla of Vater. Those proximal to it will lead to non-bilious vomiting. Associated features may indicate etiology. If a vomitus containing stale food of the previous day suggests a gastric outlet obstruction. A visible peristalsis suggests an obstruction. Vomiting early in the morning suggests intracranial neoplasm or cyclic vomiting syndrome. Associated with vertigo will be associated with middle ear disorder. And hypotonia indicates mitochondrial disorders. The red flag symptoms and the signs in a child with vomiting are the presence of blood or the presence of bile in the vomitus, severe abdominal pain, abdominal distension or tenderness, projectile vomiting, persistent tachycardia or hypotension, neck stiffness and / or photophobia. These patients need immediate investigation in a hospital. Workup for chronic vomiting should include evaluation for cause with blood chemistry, blood sugar electrolytes, serum amylase, and liver enzymes, ultrasound abdomen, upper GI endoscopy, and as indicated by available clues, barium studies, meal and small bowel follow-through, gastric emptying scan, MRI or CT brain, metabolic testing or urinalysis. It is important to remember that the children with cyclic vomiting should be evaluated during symptomatic attack before starting IV fluids, since test results are typically non-contributory during an asymptomatic period. Evaluation of a child with acute vomiting should include assessment of hydration, electrolytes, creatinine, and plain X-ray abdomen in suspected surgical causes. Promethazine and ondansetron are useful in post-op vomiting and to abort episodes of cyclical vomiting. Ondansetron given alone or dexamethasone or with dexamethasone is preferred for chemotherapy-related vomiting. Domperidone and metoclopramide are useful in patients with gastroparesis. Antihistamines like diphenhydramine are used in motion sickness. Management of the underlying condition is always essential. So that was about vomiting. As a quick recap, vomiting refers to acute expulsion of gastric contents through the mouth. It can be acute, chronic, or recurrent. It is associated with dehydration, hypokalemic, hypochloremic metabolic alkalosis, Mallory-Weiss syndrome, Boerhaave syndrome. Differences between the site will be brought about by ampulla of Vater. Treatment includes treating the cause. Thank you.